Thank you all for coming. I am Jonathan Crossette, and joining me shortly will be Dr. Collaborators, and I'll introduce her when I'm done my slides. We are here to share some experiences in challenges and successes in working in informatics in the global health setting. I've been at CHOP now 12 years, was part of the original team that selected and rolled out Epicare in the primary care network. Since 2002-2003, I've been basically data mining out of the EHR for all of the reasons you've heard why you would use an EHR and pull data out. In the last 3 years or so, I've been privileged, honestly, to play a part in our young global health program at CHOP as it's continued to grow, and I think it's heading in interesting directions still. So I didn't get to all the presentations. I hope no one else referenced this article in the Times. We have met the enemy and he is PowerPoint. I'm committing heresy at an informatics conference by sharing this, but actually if you do go to the New York Times website, it's a very good article and it makes some good points. Unfortunately, one of the points that someone makes in general is that PowerPoint makes us stupid. I will endeavor not to do that this afternoon, and I will endeavor not to put anyone to sleep before Dr. Collaborators can get started. As evidenced by my second slide, my complete presentation will be available online later. What you have printed out is more of an outline, so that will be available afterwards. And also, just so you're not trying to write down URLs really quickly, at the end of this presentation and possibly in the handout you have, I have the URLs of sites that are referenced, so please don't worry about that. So what we're going to do this afternoon is talk a little bit about the global health setting, talk about where CHOP and Penn are involved, talk a little bit about where ICT, and I have to get my first jargon in there, in global health, is at this point, and one in-depth case study is what Dr. Collaborators will share with us, which is great. And then we will, if I can get the audio working, have some actual voices from the field. We have, as I'll explain, a fellow who's in the Dominican Republic now who's graciously agreed to join us remotely if the power stays on and if her internet connection stays up. We seem to be okay here. And just ICT is sort of in the global health world, information and communication technologies, that's the buzzword instead of IT or IS or what have you. So that's what we're going to do in the next hour or so. So let me start at Children's Hospital. Our global health program probably started in earnest in the Dominican Republic. Not to go into the complete history, but back in early 2005, Dr. Rodney Fennell had an opportunity to partner with the Centro de Salud Divina Providencia in Consuelo, which is a small town north of, it's near La Romana in the Dominican Republic, where it isn't so important. Sorry, Lara, if you can hear me. It's a small town with poor power supply and limited informatics or limited internet access at this point. But they were looking for help, particularly the Centro de Salud provides service to residents of Consuelo. It also has a Bate outreach. Bates in the Dominican Republic are where folks who work on sugarcane plantations live. They're generally extremely poor conditions, often not with safe water, certainly limited power, and so on. And they were struggling with providing care to folks in the Bates, reached out to Dr. Fennell, and the partnership began. Started with teams of pediatric care specialists going down, seeing the children in the Bates, and providing care, and at the same time helping to further train the clinicians who are not pediatricians by training to diagnose and treat the kids out there. Over time, this partnership has grown. We are now funding also a pediatric care center in the town of Consuelo. We continue to support the Bate outreach. We are This center just opened last year. We have now enrolled about 236 patients. They've been seen in 658 visits. There's a part-time physician and a nurse who works, and they also do community outreach. They go to families' houses, and it's a very comprehensive program. So it's dealing with everything from nutrition to domestic violence and so on. At the same time, a very generous donor, a longtime donor to Children's Hospital, is interested in providing more pediatric care, particularly for children in impoverished countries, David H. Pincus, who also just chaired our big fundraiser the other day, the Daisy Day luncheon. He gave funds to CHOP to provide a Global Health Fellowship. And the person who will be joining us from there is one of those fellows. This is a fellowship which is a 2-year commitment in a developing country, in this case in Botswana and the Dominican Republic. And we are training them to be practitioners in the global health environment. Last year, about 70 CHOP staff traveled to the Dominican Republic or Botswana on the Batse outreach program. Last year they served about 1,400 patients in about 4 weeks' time. So it's pretty busy, it's active, and again, there's an educational component built into that. So there it is, Centre de Salud, and this is a team trip from 2004. Jerry O'Hare in the red shirt in the middle there is the program director for the Caribbean project, and you might recognize other CHOP staff there also. Yes, that's Kevin Osaka on the lower left. So in Africa, our program is very much connected to what is happening through the University of Pennsylvania, which you'll hear more about. Again, we have a fellow over there living actually in Francistown in the north of the country. His time is split between Francistown and Sparrow Village, which is an HIV/AIDS orphanage, also funded by David H. Pincus, outside of Johannesburg. So he gets the best of sort of a more small town setting and a big, vibrant city, if you will. We are partnered with the brand new School of Medicine at the University of Botswana, and we'll be, I think we're going to be collaborating on helping to educate the medical students as well as the pediatric residents there. And I need to talk a little bit about the Penn Botswana partnership because they are our partners in both of these. We need to talk about Penn because they are a big partner for us in both places. The Botswana-UPenn partnership historically came out of the HIV/AIDS crisis in Botswana. Its current focuses include clinical care around HIV/TB, women's health. There are 55 employees. They are also collaborating in education efforts at the School of Medicine at the University of Botswana. About 35 Penn trainees travel each year, and a total of about 157 people from the Penn community travel to Botswana to participate in their programs. And those are a variety of folks, clinicians as well as residents, medical students, and so on. The School of Medicine at Penn also runs a global health program and is focused largely around resident training opportunities in the global health setting. Currently there are, last year there were 89 students who participated in 27 different countries. 19 of those were developing countries, and these residents participate in a variety of projects that include clinical care, research, training, looking at electronic health records, and so on. So, a very busy program over at Penn. So, with all of this interchange, the issue of technology comes up, and oftentimes from host country nationals, the locals are very interested in improving how they're using information technology to better serve their patients, to better know what's happening in their environment. We'll talk about that a little bit later on. But this is a clinic in Botswana. Botswana is actually using information technology. It just happens to be paper-based. They are very good at keeping logs. They are, these are usually fairly well up to date in the local setting, but obviously this doesn't roll up into something that can be done at a national or even a regional level in terms of analyzing what's going on in the population, or even analyzing how well you're doing with your own care. The Botswanans also have a personal health record. Almost all the children have these. They carry them with them. This is a Botswana grandmother in the pink with her back to us, sharing her personal health record with that's a nurse from Shop in East Ramsden, and Nuri Harari is the clinician with the UPenn partnership in Francistown. They actually carry these and bring them to their appointments, and they are very complete, very nice documents. So there's no absence of the idea around how you would use information in Botswana, especially. Just not quite at the digital level yet. So in the global health setting, as you might expect, there's some issues, obviously, with getting to where you'd like to be with technology. And they vary a little bit depending on the setting, obviously. Reliable power is an issue. Solar packs and all these other things are not really widely used at this point. So keeping your computer on is a challenge. Internet access is a challenge. Forget about broadband. In most cases, it's just often not there. There's usually not a lot of funding for this kind of work. There are shortages of staff, and the focus is on actually providing clinical care in most cases. There's also not yet an established informatics community. But what there is a demand for data, a demand for understanding what they're doing and how well they're doing it. How many of our children are well immunized? Where are we seeing disease outbreaks? How can we better manage our population? How can we help improve quality across the board? There are also skilled computer science resources. Particularly in Botswana, I've had a little more exposure to these folks. Some well-trained data managers, well-trained network people, folks who know how to run networks and how to run applications and so on. There's also ubiquitous mobile phone penetration, almost everywhere. At this point, I think there's an estimated 4.5 billion handsets throughout the world. And there is, in most cases, a recognized need for exploring information and communication technology more broadly. If you're following the news at all, you're seeing that mobile phones are being used for lots of different things. In Afghanistan recently, they started a pilot project where the Afghani police are being paid by mobile phone SMS text messages that they go to their local, quote-unquote Western Union store and they get their money directly. There are lots of examples of use of money transfer beyond that, and most recently in Haiti, you may have heard that an awful lot of money was raised simply by use of SMS text messages. Also, obviously, there's the political and the social uses of mobile phones that I think most recently was best exemplified in the follow-up to the elections in Iran last year, where there was a lot of information was shared informally through the mobile phone network. In healthcare, there's an awful lot going on with mobile phones, and you're going to hear something a lot more in depth in a moment. And I'm going to share this. I was going to do this live, but we're having trouble with WebEx. So, for a great source of examples of where these things are happening and where there's successes and failures, there's this organization, mobileactive.org. And if you look on the right side on their menu, you'll see that they have these in the interest areas. And some of the health projects are very interesting. So I'm going to skip over that portion because you're going to hear about this in much more depth in a moment. Another example of what's becoming a very successful international collaboration is OpenMRS, which is Open Medical Record System. And I'll just describe this a little bit to share what is happening in this space. So several years ago, a young informatics, who just completed his informatics fellowship, young informatician, was asked by the Indiana University to go over to Kenya and spend some time there. And he went over, and being a physician and a geek, he got there and he saw what they were trying to do with their databases and had a better idea. He came back and he put a few things together. He found some collaborators, and we'll describe kind of where that's going from there. But first, and I guess I should explain the code. This is a group that convened last year outside of Cape Town for the implementers meeting for OpenMRS. There were over 100 participants at this meeting. There were another 100, 150 who wanted to come, but they didn't have space for in the resort. It's a big group. These are folks from all over, and you'll see how widely spread this is. We'll talk about why the OpenMRS initiative is interesting. This is their mission. This is first bullet point of the mission statement. Their first mission has nothing to do with implementing technology. I mean, that's the first thing to notice. They're talking about building that community of informatics leaders, if you will. The second mission, again, has nothing to do with implementing technology. Has to do with how that community can work together and expand what it is they do and how they accomplish it. The third bullet is about, oops, sorry about that. They're very committed to deploying an open source system that can be replicated, can be developed further from where it is, and basically is cost free. You can go to the OpenMRS website now, you can download this structure, this framework, if you will, and you can start to play with it, and you can build your own little EMR or whatever you'd like to do. You could use it for a research database. It's available. The technology is not challenging, even for a non-geek. But they're very interested in not so much, they're obviously not marketing a piece of technology, but they're very interested in building the informatics community overseas, or in environments with limited resources. So these are where the folks who are playing in this field now are. The original partners were Indiana University, the Reagan Street Institute, and Partners in Health. And they both have, I believe, Tony, you may remember, in Kenya, I believe they're about to cover about 2 million lives in Western Kenya with this open source system. Partners in Health is deployed obviously everywhere in South America, the Caribbean, Africa. They are partnered in Rwanda on a major project. And so on down the list. Those are the major original collaborators on this, and there are others who are getting into the space also. Again, the beauty of this system is that it's something that you spend your time and effort on learning about informatics, about learning how you deploy the technology. You're not spending money on the technology itself. In Habaroni, if you spend enough time, when you talk to this better than I, but there's a large example of essentially a failed implementation which cost a lot of money. Not sure whether you can blame the vendor or the Ministry of Health or the hospitals or what have you, but just because you buy a good product doesn't mean it's going to help, or doesn't mean it's going to work. Whereas building the infrastructure to support that kind of implementation is important. So the OpenMRS has been deployed in several different ways. This is one of the challenges actually with the open source model. but also one of the beauties of it. Partners in Health built a very robust MDR-TB module. It's the multi-drug resistant tuberculosis. Credit there. I actually stole these slides from their open source PowerPoint page. These are from Darius Giusario, who's one of the developers, but he credited everybody. Dave Thomas have built this. This is something that we're trying to implement in Botswana now. Very focused on one particular disease area, as was the original implementation. So here are all the spots where people are running OpenMRS. I took a look at where those are in the US, and I suspect a lot of these are actually folks like us at CHOP who downloaded it and are playing with it and don't actually have an implementation. However, I can tell you that there's also an awful lot about this that's going on that they don't know about at the OpenMRS headquarters, if you will, because people just download it and they play with it. The next thing they show up at a conference or something and they've done these wonderful things with it. India is exploring now actually using this for their primary care network. So that's a pretty large population. As I mentioned, Rwanda is deploying a large instance of this. And there's other examples, and you can visit the website. And people have done really cool things with this. This was mind-blowing, and I wish I could do this with a live demo, but we're pushing the edge enough on that one. This is in Islamabad, in Pakistan. They have built their OpenMRS to be integrated with Google Maps. Each one of those little person icons there, if you hover over it, it tells you all about this person and their MDR-TB treatment, and it also tells about their family members and what's going on. So this is a tool that they built to manage their population to help control MDR-TB in Islamabad. Sorry, I can't show you the real thing. If I can find a demo version somewhere or something else, I'll include that on the slides afterwards. But it is just really neat. And there's lots of other things that are going on throughout the world using this technology. But doesn't count unless there's an iPhone app. Luckily, there was a slide with an iPhone. I didn't make it up. I have no idea who's doing this, but someone has built an iPhone app for OpenMRS. So that's neat. So where I see the role for informatics professionals here in the U.S. With our partners overseas is to share our lessons, especially in terms of where successes have occurred in implementation, to help them identify opportunities to use technology in ways that will be meaningful to the clinicians. I think we can help with infrastructure, be that around education, mentorship, and then building some demonstration projects and making those successful. Were those on the slides, the ones that got printed, the URLs?
Yes.
Okay, yeah. So last year at the Global Health Conference in Washington, the whole conference was on ICT. So I left that on the slide too because I think there's some interesting presentations and some more links there. The UN Foundation is actively involved, though I didn't see anything too new on the website, to be honest, there, but I included the link and I included the OpenMRS link because the folks at Registry will be thrilled if they get a lot more hits. That ends my comments on the global health setting.